But there are other issues, you know, everybody kept saying, oh, you look so good, you know, you're doing really well, and, you know, the kids and everything, you've done a really good job. Yes, I've had to do a good job because that was life, you know. If I didn't do a good job when my husband fell ill, the girls would have fallen apart. Now they're that much older. The oldest is going to be 21, second one 20, the youngest one 16. You know, I have to be there for them for the time I've got, and, you know, and build up the memories, basically, you know. And then obviously after I've gone, that I've been preparing them for their life, you know, telling them that, you know, when you're going to look for partners, you know, what to look for, look into the family background, and, you know, make sure that you're okay and you have simple weddings, you don't go extravagant, you can use that money on buying your house and everything. And so they are being prepared, and I've also said to them, because my main worry was who's going to look after my husband when I've gone, because obviously he's quite dependent on me 24/7. So, you know, I've had to talk to the girls that, you know, between them, although there is family, there's nobody there to look after him. And through social services, and we have carers from Amicare at the moment, through them, you know, I said, I know it's going to be difficult, but between the three of you, you have to deal with that. But obviously you've also got the added pressures, not just of the cancer, but also you have daily life, you know, the worries and the bills, and financially everything's always on your mind. But then I've got to a point now where I used to worry a lot, and I think, well, whatever's going to happen is going to happen. No point worrying about it, because you just make yourself ill. I mean, I do still get worried about things, but not to the extent that I used to, because things will happen as they happen. There's nothing you can do about it. And, you know, and that's the way life is. And, you know, I've had my treatment. It's coming on to a year now where I've been diagnosed. I still get very nervous when I go and see the oncologist, because back in October, I thought the cancer had spread again, so I had a CT, and he said, yes, the cancer's still there, but, you know, we're going to carry on with the hormone tablets that I'm on, the tamoxifen, and who's just going to see me regularly. And in the future, if it does spread, he says they can contain it, but it's not curable. You know, I might need more radiotherapy, but I'm on palliative care at the moment.